In Ontario, the small yet essential physiotherapy clinics and rehabilitation businesses tirelessly heal those injured in car accidents. But a silent struggle persists against the Financial Services Regulatory Authority of Ontario, or FSRA, which ironically seems to favor insurance companies over these healthcare providers. In 2014, insurance companies lobbied for and received a redundant regulator of health service providers in FSRA, under the pretext of preventing fraud. This redundant regulator has increased operational complexity and added licensing fees, even though FSRA's data has shown service provider fraud is virtually non-existent. These health service providers were already effectively regulated by their healthcare colleges, and the public derives no benefit from their additional red tape. Service providers are asking to remove this redundant regulator who adds no value to them or the public. FSRA, composed mostly of former insurance professionals and former industry lobbyist employees, sets the remuneration rates for health professionals who treat people injured in car accidents. This does not seem fair. As a result of the policies at FSRA in 1996, healthcare professionals were paid $120 per session. Fast forward to 2023, and that rate has decreased to $99.75 per hour. Interestingly, while FSRA consistently increases its own staff salaries and executive compensations, it neglects to adjust the remuneration rates for healthcare providers. These rates are meant to cover expenses like rent, utilities, taxes, loans, office supplies, clinical education, legal fees, and staff salaries. Further showcasing its bias, FSRA has been annually adjusting an indexation that benefits insurance companies. This results in an ever-increasing deductible on insurance claims, making settlements burdensome for accident victims. For instance, in 2023, a $50,000 settlement is subjected to a $44,000 deductible. So, FSRA understands inflation's consequences, but not for health service providers. Moreover, FSRA still needs to index the health reimbursement paid by auto insurance companies to the Ministry of Health since 2006. This failure allows these companies to exploit the public healthcare system, pushing costs that should be their responsibility onto the system. Then there's the Healthcare for Auto Insurance Invoicing System, or HCAI, and the invoicing requirements in general. Introduced in 2010, HCAI has proven to be the most complex invoicing system, burdening clinics with an estimated $40,000 annual cost per clinic, while insurers can navigate it without any hurdles since they pass along all inefficiencies to consumers. That's $40,000 to send invoices after the services have been provided. Remarkably, FSRA has made it easier for insurers to adjust their rates in response to market pressures, while small businesses providing healthcare services can't do the same. They are left grappling with an administratively heavy system and rates falling behind since 1996. The injustice is stark. During the pandemic, insurance companies received refunds and discounts on licensing fees, while health service provider clinics, mandated to shut down for 3 months, received no support. When insurance companies could switch to remote work models, clinics were left high and dry. The pattern is clear. FSRA's decisions and policies demonstrate a bias favoring insurance companies over the healthcare providers it licenses, contributing to an alarming power and financial disparity in Ontario's healthcare industry. Ontario's healthcare providers, economy, and community deserve better. Professionals are leaving the industry in Ontario since they are burning out due to abusive regulations and red tape. In conclusion, a troubling pattern of bias from the Financial Services Regulatory Authority of Ontario, FSRA, against healthcare providers and in favor of insurance companies is evident. A redundant regulatory layer, introduced in 2014, only adds unnecessary complexity and fees to an industry already effectively regulated by healthcare colleges. FSRA, predominantly composed of former insurance professionals, has set remuneration rates that have decreased for health professionals but increased for FSRA staff. FSRA's annual adjustment of indexation benefits insurance companies by increasing deductibles on claims, burdening accident victims, while ignoring the indexing of the health reimbursement paid by auto insurance companies to the Ministry of Health. The complex Healthcare for Auto Insurance Invoicing (HCAI) system, introduced in 2010, imposes a financial burden on clinics, estimated at $40,000 annually per clinic. FSRA's policies during the pandemic favored insurance companies with refunds and discounts on licensing fees while leaving health service providers unsupported during mandated shutdowns. This pattern underscores FSRA's favoritism, contributing to a concerning power and financial disparity within Ontario's healthcare industry. We must advocate for a fair and sustainable system that treats all stakeholders equitably, ensuring the vitality and sustainability of our healthcare services for all Ontarians. Join us in demanding fairness from FSRA.